So, Dr. Peat, it's long been known that people with high functioning of thyroid or hyperthyroidism, that they can suffer from high blood pressure. But there's also research that shows that people with low blood pressure can also people with low thyroid function can also be suffering with high blood pressure.
In general, the research shows that increasing thyroid function lowers blood pressure, and I think what has happened over the last 30 years or 40 years, I've seen 2 or 3 people who actually had hyperthyroidism without a doubt, but I've seen dozens who were told by their doctors that they were hyperthyroid, but as I encouraged them to talk to their doctors about how the diagnosis was made, many of them said, but the doctor says I'm at the same time hypothyroid and hyperthyroid. Doctors have been so confused that they say you can be both hyper and hypo at the same time. And most of these people that I have seen who had a diagnosis of hyperthyroidism were actually classical hypothyroid cases, just that doctors don't read the old textbooks anymore. For example, one thing that happens very often in hypothyroidism is that the activity of the sympathetic nervous system and adrenaline production increase to compensate for the lack of thyroid actual energy production. And I've seen people with 40 times the daily output of adrenaline times the normal amount who were hypothyroid.
So because our body's so low thyroid and their metabolism is so slow, their body's trying to compensate by stimulating adrenaline production. And, of course, what does adrenaline do but raise blood pressure?
Yeah, and I've seen people who had as fast a pulse as 180 beats per minute at rest year after year, who that was taken as one of the diagnostic features for hyperthyroidism. But when they took thyroid, within a week, for the first time in years, they had a normal pulse rate of 80 or 90 by lowering the adrenaline.
Because then it was supplying the thyroid hormone that they were lacking in the first place.
Mm-hmm.